Hey Floxed community, this is Dr. Hugh, and today what I want to do is a very quick video on a mold test that came back, and I'm going to go over some little interesting findings that we found. So let's get into this. This is going to be a short, quick video. So right away, aspergillus. This is a mold test. It's a through the organic Great Plains organic acid test. It's a mold test. It's a simple test to do. It's a first morning void urine. You send it into the lab and we get this result back. Now, mold is very devastating. If you haven't seen any of my videos on mold and mycotoxins, please do that. This is a guy that's 41 years old. He had chronic sinus infections, had sinus surgery, and was put on Cipro and then got Floxxed. So you can see here that the gliotoxin here, you see his range here is 5,764. That needs to be less than 200. So 5,764 is his lab, less than 200. Bingo, what did we find? We found mold toxicity, mold exposure in a big way. Now you can sometimes determine if it's food or if it's from actually like building exposure. And this was no doubt from building exposure. He's been using a humidifier for many years, and this is what we found after we did this test. He went back and he looked at his humidifier that he's been using, and guess what this is right in here? This is all what? Mold, ladies and gentlemen. So what did I learn from this case is ask a very simple question. Do you have a humidifier or even a dehumidifier which collects water? So the humidifier was blowing this air out in his room and he was getting exposed to mycotoxins and mold and had no idea that he was doing this. And he did this for many 10, 15 years since he's had this sinus infection, had surgery, and then was put on Cipro, and bam, then all of a sudden he gets all these weird symptoms. So one of the things with this lab is a lot of his other labs came back pretty like okay. Nothing was like hugely like a big red flashing bulb saying this is a problem. This is the one thing that came in that was like a huge problem. So what are we going to do? Well, we're going to eliminate mold exposure. He's still going to do some basic in-house testing to make sure there's no other mold leaks or anything like that, and then we're going to start a detoxification program with binders, and there's a whole variety of different things that we're going to do, and then we'll retest. So if you like this video, give me a thumbs up or subscribe to my station. I give a lot of content out there, just trying to push the content out there to get people educated so they know where there's help, there's hope, there's a possibility for you to get better. You just have to find the true answers, the true source of health and healing and information, and take it from there. So take care, Floxed community, YouTube community, or wherever you're seeing this piece of information. Take care. Bye-bye.